WYPL-TV 18 presents The Power of Sleep, sponsored by Methodist Sleep Disorder Center, offering free community education seminars Tuesday, April 21st and Tuesday, July 14th at the Jewish Community Center. Each seminar features a physician speaking on an important sleep-related topic. Admission is free. The seminars begin at 6:30 p.m. on Tuesday, April 21st and Tuesday, July 14th. More information can be found at www.methodisthealth.org or 901-683-0044. Methodist Healthcare, embracing the miracle of life.
Everybody, and welcome to the second edition of The Power of Sleep. I'm your host, Susan Gray, and our guest today is Dr. Neal Aguillard, pulmonologist and sleep specialist. Welcome.
Good to be here.
Thanks for coming. And last time on our show, we talked about what good sleep was, what bad sleep was, and some common sleep disorders. And today we're going to talk about the most common sleep disorder of all, which is sleep apnea. But there is one other comment about sleep disorders I wanted to make, and that was a quote from William Dement, the grandfather of sleep. Yeah, he said that the most dangerous sleep disorder was ignorance. And so I think that's really the motivation for doing this show, is so that people will really understand what's going on. So on sleep apnea, what does it have to do with snoring? Snoring and sleep apnea seem to be hand in hand.
Well, almost always, if you have apnea, you snore, a few exceptions. But not everybody that snores has apnea.
And that's the rule.
That's a pretty hard and fast rule. And the same mechanism that makes you snore also is usually what makes you have sleep apnea. There's something in your throat above the opening of your windpipe that is relaxing.
Above, say where? Say right here?
Windpipe's right about where your Adam's apple is, and usually it's someplace, sometimes multiple places, above the voice box that are relaxing, and when you inhale, it makes a sound.
Right. So describe an apnea as it's happening. What's the process? A person is lying down, they're sleeping, they take a breath, apnea starts to happen. What's going on there?
There's some place, when you sleep, when you breathe, there's a concert of muscles that open and close the tissue above the opening of your windpipe. And what happens when you have apnea, these muscles relax inappropriately, and the space above the opening of your windpipe relaxes. It isn't necessarily just one spot that's a bottleneck for the air to go down to your windpipe. It can be multiple spots. It can be any place from the nose to the adenoids, which are above the roof of your mouth, the roof of your mouth, your uvula, your tonsils, your tongue, and some of the muscles that are right above and structures that are right above the opening of your windpipe.
And so then that causes this breathing to stop when that obstruction happens. And then what is happening in the person's brain when their breathing stops?
The worst part of this whole process is that you get an arousal of your brain when you're sleeping. An arousal is going from a deeper, more restful stage of sleep to a lighter stage of sleep. And the more arousals you have, the worse you're going to feel.
What's a normal amount of arousals per hour, just for the normal sleeper?
Usually about 22 arousals an hour in a healthy adult is something that you would expect.
In a moderate sleep apnea patient, it would be somewhere around
30 or more.
Too many, because the brain thinks that you're not going to breathe again.
That's right.
So it does something to make you wake up. And that's part of the danger of this, is that it interrupts sleep. It interrupts the sleep cycle, which is, would you describe the sleep cycle? Because I think most people may not realize about that, the 90-minute, 1, 2, 3 stages.
Do you want me to?
I would love for you to.
Sure. You generally have two different types of sleep. You have REM sleep and non-REM sleep. REM is an acronym for rapid eye movement. When you're in REM sleep, the only thing that's moving are your eyes, and everything else is paralyzed, and that's where you have really vivid dreams, but everything's paralyzed. Non-REM sleep, REM sleep is called the active mind in the inactive body.
Right.
Non-REM sleep, you don't have these eye movements. Eye movements are just a marker, and your body functions normally, and you move, and it reacts to heat and scratching, and you do things in your sleep. but there's not a whole lot of brain activity, and generally non-REM sleep is going to be the inactive brain and an active body. And it comes in cycles. Every 90 seconds or so, you're going to have a REM period. You usually enter sleep through non-REM sleep.
So if you're breaking the cycle up all the time, your body's really not getting that rest.
That's right. Even though you're unconscious, and even though you may not even really wake up, if you have lots of arousals, your brain is never allowed to go into the really deep, restful sleep for a long period of time that makes you feel refreshed the following day. So you may be in bed 8 or 9 hours and you wake up and you don't feel like your sleep's done any good because you've had these irritating events in your brain that keeps your brain from getting into that deep, good sleep.
Well, I think the most important thing you said right then is that people don't know it's happening. You could be arousing between 20 and 50 times a night, and you wouldn't know that you weren't sleeping. That's how some people say they sleep long hours, but they're not feeling good in the next morning.
Right, and there's some gender differences. Generally, men snore loudly. The wife complains about the volume of the snoring. The husband comes in to see me, and he's adamant, there's nothing wrong with me.
Always.
I go to sleep, and I get up the next day, but I don't feel good the following day. Ladies tend to be aware of waking up more. So we see insomnia. I'm just ballpark estimate 30 to 40% of women I see will actually say, something's happening and now I'm not staying asleep at night. So there are some gender differences as far as how people present with apnea.
Right. Well, okay, you know, there was a day when snoring was only portrayed in cartoons, and it was funny, you know, the Z's coming out of the mouth, and no one takes that seriously. But not only do men snore and women snore, but is there pediatric snoring? Do little kids, do babies snore?
Sure, babies snore. Which before we go into that, which begs, what is snoring?
Thank you.
Because not all sounds that you make when you sleep are snoring. Snoring is a sound you make when you inhale. There are a number of different sounds people make sometimes when they exhale, and those generally are not dangerous. But snoring is going to be some noise you make when you inhale. But kids, babies, can snore. And usually whenever children have snoring, the tonsils are enlarged, adenoids are enlarged, that sort of thing. But yeah, kids snore.
So it's a little bit simpler to stop a snoring problem with surgery in kids than it would be to go that way in an adult.
Right.
Because the tonsils and adenoids, that's a pretty familiar procedure done with children.
Right.
Yeah.
Generally speaking, the younger you are, the more likely getting your tonsils and adenoids out will cure surgery and apnea.
Yeah. And so that's something to think about. Don't just ignore that. You shouldn't hear your children snoring.
Right. And the presentation in kids is different than adults, just like the gender difference. There are gender differences. Adults tend to be sleepy during the day when they have apnea, whereas children may not be sleepy, but they're irritable and they're hyperactive. So the presentation is not the same.
Yeah, and we're going to do several shows on pediatric and pre-adult
Whole different
problems.
thing.
Whole other ball game.